Tuesday, I was asked to go to I can only describe it as an emergency meeting of parents of children who were in a creche, in this case a creche called the Magic Roundabout, who were already paying €1,100 in monthly creche fees, which I just find staggering. But those fees were going to go up to $1,250, and 20 of the parents were going to lose their kids' places in the creche because Taoiseach came in, said they needed to make changes. They made the necessary changes. Then Taoiseach came back and said, well, because of the changes you've made, the floor space has now been reduced and you have to get rid of 20 of your kids. And this is in the middle of the term, right? Unbelievable. And this comes against a background where I think it's 27 creches are threatened currently, and parents are saying they're being left in the dark about these things. These parents absolutely just flabbergasted, shocked, and don't know what they're going to do. In this case, they've asked for a meeting with Minister Zappone to discuss the matter. And I want to stress, Taoiseach, if there was any health and safety or fire safety issues, these parents would be the first to say, you know, something has to be done. But what's not acceptable is the sort of ham-fisted, box-ticking, blunt instrument approach that appears to be being taken by Taoiseach in terms of creche facilities, compliance and so on. And the big point that the parents made is, how can you bring in a scheme for 2 years free preschool care, the ECHI scheme, but not actually provide for the places for them? Right? And for the shockingly high levels of cost that these parents have to endure. So I'd like you to comment on that, because judging from the attitude at that meeting, there is an explosion on the way on the issue of childcare costs and the lack of childcare places.
Thank you, Deputy. Taoiseach, just over 4 minutes.
Thanks, Ceann Corrin. I want to thank deputies for the questions. Deputy Burton raised the issue of undocumented minors living in Ireland. And as I think the House will be aware, from time to time we do introduce schemes to regularise undocumented migrants in the country. This isn't an amnesty, of course. We've agreed on EU level that there will not be amnesties, and that's part of our commitment to our European partners. And also, any time we have a scheme to regularise undocumented migrants, we always need to consult with the United Kingdom, because it does have impacts on the common travel area. But within those confines of the Common Travel Area and the EU Pact not to have any amnesties, we do from time to time have schemes to regularise migrants. Indeed, the one that we had most recently was a scheme to regularise people who came here on a student visa from outside of the EEA and became undocumented for one reason or another. And we offered regularisation to those who came to the country on student visas, became undocumented, both for them and their dependents. That just finished up this year. And we actually regularised 2,000 people under that scheme, and actually worked very well in my view, and has been a very useful scheme for me in going to the United States, because I can say that now in Congress, in the White House, we're not asking you to do anything for our undocumented that we haven't done here in Ireland. So if the US were to copy our scheme, essentially they'd say to anyone who came to the US on a J1 visa or a student visa, became undocumented, that there would be a pathway to regularisation for them, and has become useful for me to be able to go to the US and say we're not looking for anything from the US that we haven't done here in terms of undocumented who entered on a student visa. There is another group that we do want to look at next, and it is exactly the group that Deputy Burton mentions, and those are people who came to Ireland as children and really know no other home than Ireland. They're not going to be deported. And they've never really lived in the country in which they were born, or perhaps the country in which their parents were born. Some of them were born in Ireland, so we need to, that's the next one that we're examining doing, but we do need to get these right and make sure that, that they're properly organised and can't be abused or don't undermine our commitments to the European Union or to the Common Travel Area. But it's the next group that we want to take a serious look at, and I have met some of those young people, and I imagine Deputy Burton has. You know, they grew up here. They speak with Dublin accents or Cork accents or Donegal accents or whatever accents. They're not going to be deported. It would be right to regularise them. We just need to get it right, and we got it right for the students. I think we can get it right for those what Americans would call dreamers as well. On universal health care, the policy of universal healthcare is to provide free or highly subsidised healthcare for all. There are many models under which that can be done across the European Union, very different models. There's often an assumption in Ireland that the NHS is the system they have across Europe. It's not. Every country has a very different public health system, and Sláintecare doesn't prescribe which model we should follow. It says, it talks about co-payments, it talks about free services, it talks about many things, but it's something that we need to do step by step. I think we made a lot of progress already on GP care. Nearly half the country now has access to free GP care, and that's going to be extended to children aged 7 and 8. Next year, having extended it to those on lower incomes this year, increasing income limits this year, and carers the year before. We're also, as people know, in every budget, we're reducing prescription charges, both for people with medical cards and for those who don't, by reducing the DPS threshold. That will continue, and we're extending eligibility for medical cards. One of the first things we did as a Fine Gael Independent Alliance government was to give medical cards as a right to children with serious disabilities, regardless of their parents' income. And under previous governments, they were often subject to review. Children with very serious disabilities would lose their medical cards because their parents' incomes went up, and that doesn't happen anymore. Any child in receipt of DCA is also entitled to a medical card, regardless of their parents' income. And the next change will be around the income limit for the over 70s, improving that, so that more people over 70 can contribute. The number of medical cards goes up and down all the time, and it generally goes down when there's more people in work. That's what you'd expect. Well, the threshold has stayed the same, so the reason why the numbers have gone down is because incomes have gone up. That is the reason why the numbers have gone down, which I would have thought most people would think is a good thing. Obviously, Fair Deal is also a form of universal healthcare with co-payment systems, and we need to do something similar around home care. We are examining hospital charges as well as a possible further step, but it's not something that you do in one go. It's something you do over a period of budgets, and we're making some progress on that. Deputy Martin asked me a very fair question. When are the numbers of people who are living in emergency accommodation, the number of people who are homeless, going to go down? And the truth is I can't answer that question. I can tell you that we've taken more people out of homelessness in the last year than ever in the country's history, but the numbers becoming homeless is roughly the same, and that's why the numbers have been roughly the same for the past year or so now. And the drivers of homelessness are different ones. It's people losing their private rented accommodation, but it's also people who experience family breakdown. And there's no reliable way to know how many people are going to become homeless. We can know how many people we're going to stop, how number of people we can stop becoming homeless when they come to us, or the numbers that we can get out of emergency accommodation. And we've never taken more people out of homelessness, but at the same time as many people become homeless, and there's no way of predicting that for sure. What I can say though, and I think this is worth putting on the record at all, in the year before Rebuilding Ireland was introduced as our policy, in the year before Rebuilding Ireland became our policy, the numbers of families who are homeless increased by 60%. In the past year, the number of families who are homeless increased by 0.17%. So that shows the difference that Rebuilding Ireland has made. Hasn't got the numbers down yet, but before Rebuilding Ireland, homelessness was rising at 60% a year. In the past year, it's risen by just over 0%, 0.17%. On social housing, by the way, we are meeting our targets. And in relation to the question around Deputy Doherty's Special Advisor, he's a secondee from another part of the public service, and as is the norm, when somebody is seconded from one part of the public service to another part, they stay on the same salary.
Question 6, Taoiseach. I'd remind members, if they consume the time asking the questions, it leaves no time for them to be answered.
I mean, if 5 questions were asked, one question takes up 3 minutes of an answer. I mean, there must be some discipline on answering too.
True. Well, anyway, we're at number 6, Taoiseach.
Ceann Comhairle, I propose to take questions 6 to 9 together. The Cabinet Committee on Security deals with issues relating to justice, defence, Garda reform and national security. Last met on Wednesday the 30th of October 2019, and the next meeting will be scheduled in the next few weeks. It encompasses matters that were previously under the remit of Cabinet Committee G, Justice, and F, National Security. The implementation of a policing service for the future. The Government's implementation plan for policing reform is progressing well, and updates on the progress made to date are available on the Policing Reform webpage at gov.ie. As part of the implementation of the report of the Commission on the Future of Policing in Ireland, the National Security Analysis Centre was established to coordinate across the relevant departments and agencies in providing strategic analyses to government. The Centre is establishing its business arrangements in close cooperation with partner departments and agencies. With regard to the transformation of the Department of Justice and Equality, significant progress has been made this year, including detailing the new functional design for the new department and implementing it in August and September. The fifth report of the Effectiveness and Renewal Group is published on the department's website at justice.ie. Work is ongoing to implement the recommendations of the Public Service Pay Commission with regard to the Defence Forces, and I welcome the decision taken by both recognised associations, PD Fora and RACO, to accept the recommendations. While this will be an important step in helping to get our Defence Forces back up to full strength, I accept that more needs to be done on both pay and non-pay issues for the Defence Forces.